Well, I was seeing another chiropractor, and you went into his office to help him when you first started your practice here in Bountiful. And I had gone to my granddaughter's jump rope exhibition, and in my hurriedness to get there, I fell and really banged up my arm and my neck and several ribs. And when you proceeded to help me, you used strengthening exercises after you had done the adjustment. And I was amazed that those exercises that you were giving me would help keep my ribs back in alignment and my arm and my shoulder. So I really saw quick improvement and lasting improvement.
Fantastic. Well, tell us about your first experience with the Pro Adjuster.
Okay, my husband and I had been serving a mission in Florida, and I was the mission secretary, and while I was there, I was doing a lot of typing and using my hands in a lot of different activities to get books ready for missionaries and whatnot. And I noticed gradually this thumb was in this position, and I could not move it down unless I took my other hand and brought the thumb down. And the doctor that I was seeing at that time said, well, you're going to have surgery, and they're going to have to sever the tendon that causes that thumb to be so stiff. Well, I wasn't out there on a mission to have surgery, so we waited until we got home, and the first thing I did was to come to see you. And you had the Pro Adjuster, and you explained it to me, and I was skeptical, to be honest with you, because it was a machine. But what I did learn was that with the diagnostics of this Pro Adjuster, you could tell exactly where the misalignment was, and you could adjust it accordingly. You didn't have an under adjustment and you didn't have an over adjustment. But after just one treatment, I was able to bend this thumb, but then it would quickly go back to that position. So then after a few more adjustments, you got it to where it's just as normal as it can be.
Were the treatments painful?
No, the treatments have been far less painful than a manual adjustment.
Fantastic. How has in terms of your life, how has the treatment in our office changed your life?
Oh, first of all, I look forward to coming here because you're very gracious and very friendly when we come in here, and you listen to what I'm telling you. And that I appreciate very much in a medical situation, medical care. I also have a problem with my left knee. It's bone on bone, and I have had some surgeries on that knee, and I have been told that because of the bone on bone situation, I'm going to have a total knee replacement. Now that was approximately 6 years ago that I was told that, and since then I have been told that again, and they said, you'll tell us when you're ready to have that knee replaced. But you have kindly given me an adjustment on this knee every time I come into the office, and I have prolonged that surgery. I don't need it yet. Eventually I probably will, but you keep me walking, you keep me in full motion, and I appreciate that.
Thank you. Who have you referred to our office?
Oh, do you want to know names?
Just the relations.
Okay, I do come in contact with a lot of people, and I listen to them, and when they tell me that they've had back problems when they're golfing or when they've had an injury. A friend of mine recently fell down the stairs. She had to what's the word I'm looking for? She had to actually cancel her trip to Israel. And as I've watched her heal, her neck and her shoulders are really stiff, and she doesn't have the mobility that she needs in her neck. And I've referred her recently, and I just believe so firmly in what you're doing to treat patients. And I've seen my friends that have been coming up here. I've sent family. I've brought my grandchildren up when they've taken a tumble, and you can tell from their behaviors that they're not just quite the way they usually are, and okay, they need to get up and be adjusted. And I brought them up. You've sat my little ones on your lap, and you've given them an adjustment. And they have felt very comfortable. And whenever I've said, do you need to go back and see Dr. Smith? Immediately they remember you and want to come back.
Fantastic. How would you say our office staff has treated you?
Just very welcoming and very efficient. I'm now using my insurance and to pay for some of these adjustments, or pay a portion of the adjustments, and they have graciously filed those claims
Yep.
for me, so I've appreciated that.
Fantastic. Anything in your life that you're able to do that you couldn't do before?
Oh, a lot of things. Yeah, I firmly believe that chiropractic is what's keeping me up and going and mobile, and I have a family history of my brothers all have knee problems, and I'm the oldest of all four of us kids, and I have more mobility than all three of my brothers, so.
Fantastic. What would you tell someone who's a little bit apprehensive or worried about getting hurt at a chiropractor?
I don't think you have to worry about that at all. If you're honest with Dr. Smith, I think he'll take into account everything, your condition, your situation, and you will not feel pain. You can feel the adjustment, but there's no sharp movements. It's a very gentle, pulsating adjustment, and I've appreciated that.